What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host, Dr. Keoni Tita. Keoni, how
Hey
are you
everybody,
today?
I'm good. Thanks, Bryan. Hey everybody, thanks for listening once again. This one's a great one because I see this complaint all the time. So we're going to talk about back pain
Yes.
today from a doctor of PT's perspective. So
Yeah,
I'm excited
awesome.
about that.
So we've had a few episodes about back pain. What I'm going to read off of here and kind of my notes for this discussion for us today, Keoni, is a seminar I have given at a couple local gyms or to some couple groups here locally in town. And if you want this PowerPoint or this presentation or the notes for this this discussion, you can email us. Email me directly at bryanbrozy@gmail.com, and I'll get you these notes and get you on my listserv so you get weekly emails with actionable health tips like what's in this podcast directly to you. So if you want to email me and get this PowerPoint, please do. But we're going to talk about back pain, like you mentioned, Keoni, and just take a nice little stroll through a few things about our back and then talk about 4 specific muscles that we can use and we want to use to provide some stabilization to our spine. So we've talked about spinal stabilization. We've talked about back pain. This is a nice overview of kind of our spine and then getting into some very specific things we can do. So let's go ahead and start by getting into our spine and just kind of what it is. So we know that we have 33 vertebrae, Keoni, and those are fused and unfused. So like the sacrum. Sacrum is 5 fused vertebrae. It doesn't move, right? Versus the other vertebrae, some other vertebrae move and interact with each other individually. So the fused and unfused one, the whole point of the spine is that it provides stability and protects the spinal cord, the nerve roots, and the cauda equina, which the cauda equina is just the end of the spinal cord. It looks like I think that's Latin for horse's tail. And it does indeed, if you've ever seen it.
Yeah, it looks like a horse's tail.
It looks just like a horse's tail.
Yeah.
There's segments of the spine. I'm going to run through those, but there's a reason why the segments of the spine are important. And they're important because they all move and interact with each other differently. And that's due to the facet orientation. The facets are where the joints actually move. They face each other. That's where the word facet comes from. So you have a facet of one vertebrae and the facet group of another vertebrae interacting with each other, right, on top and on bottom. So the segments of the spine, subcranial, mid-cervical, upper thoracic, mid-thoracic, and lumbar segments are the segments of the spine. And just really what's important to get from that is that in the neck, we have more rotation than we have in the lumbar spine, for example. So that just gives us some information on the different segments of our spine and how to use them. So like for the lumbar, just based off facet orientation, flexion and extension is a lot more of the motion that area is for. And with our neck, we have a lot more rotation. Actually, 50% of the rotation in the neck comes from one joint, and that's the AA joint, the first 2 vertebrae. And that's just due to the geometry of how they sit and interact with each other. But it's actually really cool if you sit there and you're sitting there right now, and you try and look behind you, you'll notice this. If you try and look more with your whole body, more of that's going to come from the neck than it is like your trunk and where your ribs are and that sort of thing.
Yeah.
We have natural curvatures of the spine, right? We've got a lordotic curvature or lordosis in our lower back and a lordotic reverse C curvature in our neck as well. And we have a kyphosis, which is kind of the peak of a normal C that's in our thoracic spine. And that's important to know because we want to maintain those natural curvatures, right? They're there for a reason. So we put stress in areas that are designed for the types of stress that we're putting there. And if we get too out of the Goldilocks position of these curvatures, we're putting stress where stress isn't supposed to be put, or that much stress or that type of stress is supposed to be put. And that's where we get long-term problem, chronic injury. And that's probably what we're seeing a lot of, Keoni.
Yeah. And I guess it relates to that upper cross, lower cross, right?
Yeah, it absolutely can. So those are, absolutely. And those are 2 previous episodes that just recently came out. And then we have spinal stabilization. This is a topic we've done a whole podcast on. But just in general for this discussion, we want to know that it requires muscle performance for what we're going to talk about today. But there's 3 types of spinal stabilization: passive, neural, and then active. So obviously that last one is where we're really actually using the muscles. The passive structures would be like our intervertebral disc, ligaments, those sorts of things, connective tissue. And then our neural inputs are literally our neural inputs giving us signals about how to stabilize and move and protect our spine as we go throughout. There's global and local musculature stabilization. So speaking on that active stabilization, There's global and local stabilization. And why this is important to make the distinction is we get a lot of global work in our typical exercises. So like thinking of squats, things like that, where we're using big, powerful muscle groups. Those provide a lot of global stability. The local stability comes from muscles that are a lot smaller and work at specific segment levels. So like the multifidus that we'd love to talk about, we're going to talk about here in this episode. But the multifidus provides that local muscle stabilization. So this is where you're really getting in and actually stabilizing segments of the spine versus if you think about like the lats, right? Attaching to the thoracolumbar fascia, which can come and attach to a variety of vertebrae, but they're also huge and spans and goes and attaches to the arm. So it's big local or global stabilization versus the multifidus, which is a lot more segmental and providing segmental stability. And that's what I see as a physical therapist, people lacking the most. And that's kind of the cause of these reoccurring back pain instances. We did an episode, Keoni, where we broke down like the types of back pain physical therapists classify. And this is one of those types. Kind of, we talk about the key giveaway there was that it's reoccurring and kind of remitting, but then consistently reoccurring. And that would be a great candidate for active stabilization.
If it's reoccurring, are you saying that it's more of local stabilization?
Yeah, very likely. Okay. Very likely. So because typically then someone.
So we're talking about multifidus instead of the big.
Like a muscle, lat or big things. Yep. And the whole point there is just like with that local stabilization, we'll talk about it when we get into the multifidus, but that local stabilization needs to be trained just as much as we're getting the global stabilization trained, if not more. And we're getting a lot of global training in just typical daily life, right? Bending over, different things that incorporate functional movements and squats.
And in your typical gym, in your typical gym, it's all global. Nobody's really thinking about the local stuff.
Exactly. And just a key thing on posture and why posture is so important. This is a study from the physiology of joints. And for every inch of forward head posture, it can increase the weight of the head on the spine by an additional 10 pounds. So that really plays into the upper cross syndrome.
Right, with the head forward.
Yeah. So for every inch forward, the head is an additional 10 pounds. And if you think about that exponentially, as we lengthen that physics equation, right, we go further down the neck, it's hard to imagine how much stress you're putting like on that C7 vertebrae.
Right. So the amount of pain you have to live with that, on a daily basis with that.
Absolutely. I mean, if we're two inches forward, our head's an additional 32 pounds. And you multiply that exponentially.
Crazy. Yeah, that's crazy. Yeah.
So that's just a little bit on posture. I do want to kind of, so I said I had given this at a gym before, and I call it an active seminar. So we'll do this seated, and we can kind of go through this together just so we can get some motions down. So Keoni, we'll sit upright. We'll put our hands kind of on our hips, like at our ASIS, our little hip points that are in front of us. And we're just going to do like a sitting or a standing or wherever you happen to be, cat-cow. So what we're going to do first is we're going to do flexion. So you're going to look down like you're trying to look at your crotch.
Yep.
And that, if you continue that as far as you can, is flexion, right? And then if you go and try and look at the ceiling, so the exact opposite from the floor to the ceiling, that would be extension.
Something and again, we rarely do in real life, right? We rarely do extension.
We talk about it a lot, Keoni. We're the forward flex society.
Yep.
So if we do extension, you'll see, and if you're standing, you may see a little bit more of that flexion extension come from your lower back or as opposed to your middle back, for example. You have a hard time rounding out those ribs. And then we have rotation, which is if you were to look to your left and you look to your right. And again, if you do this, you're doing this at home listening to us. If you just look to your left, I want you to try and look back to your left even a little bit further. And I bet you feel like most of that is coming from your neck. It's your neck that's really straining to look back and increase the range of motion. I think that really speaks to what the joint the joint anatomy and how they play together and why we get more rotation in the neck. And then we have side bending. So side bending, if we're sitting there, would just be like we were trying to reach one of our hands perfectly to the side of us, right? And we can do that left and right. What's interesting about these movements is we just broke them all down individually, but they all occur either at the same time or in tandem with each other. And at various points, parts of the spine can be flexed, part of the spine can be extended, all that kind of stuff. And we know in the neck, based off the geometry, we essentially have one-to-one motion because they're generally at a 45-degree angle, those joints. And so you have side bending with rotation, with extension, if you look back, for example. So all these motions are coupled. So we're not, while we just broke down those motions individually to kind of be educated and talk about them, we need to know that our spine is performing all those motions as we live our daily lives and do different activities. So we're going to go ahead and get into these 4 essential muscles. One of them is our favorite, Keoni, the multifidus. So what we know, and we've talked about it plenty, is the multifidus and the transverse abdominis. They work together. They do a co-contraction to increase intra-abdominal pressure and stabilize the spine. I have a great picture in this presentation. If you want that, and send me an email, I'll get it to you. And the picture has the diaphragm on top. It's a side view of the spine. Diaphragm on top, pelvic floor on the bottom, transverse abdominis in the front, and the multifidus in the back. And you get a real good idea, if you kind of picture that in your head, you've essentially created a box, and a box of safe, stable spine that goes around your vital organs in the lower back there. Right. What we want to do is use that box as a natural weightlifting belt. We want to use that natural weightlifting belt to stabilize and protect our spine as we're going throughout our day.
Yeah, a lot of strength and conditioning coaches. I just remember growing up and working out, like it was really important before you went to a squat or a deadlift or anything, especially going heavy, that you really focus on tightening that belt so it stabilizes everything.
Yeah, and some cues that I really love for tightening the belt. One cue that always works, everyone seems to get, is acting like you're sucking on a tight pair of pants. So sucking your belly button up and into your spine.
Right.
So that's where I start with everyone, is that initial transverse abdominis contraction. You can do this wherever you are, whether you're sitting, running, standing, whatever. Squeeze your belly button in and up as you listen to this. And try and do it without puffing out your chest, because that's what I see the first kind of compensation when we're learning this to begin with. But that creates that pressure that you're talking about, Keoni, and gives you that natural weightlifting belt. And then another cue that I love that I want to mention here is to exhale when you exert yourself. So people, I know you and I, Keoni, have encountered this a lot, where we're teaching people how to breathe, and especially breathe while they're exercising.
Right.
And I always tell people, exhale when you exert yourself. That's one of the reasons I love kettlebells so much, because you're increasing that intra-abdominal pressure with that powerful exhale, and then you're tightening that belt that we want to wear as we're doing these activities. Yeah. So exhale and exert at the same time. When you're exerting your force is when you want to exhale. So let's get into the multifidus. I just want to break down a little bit of where it attaches. We'll be brief with this so it doesn't become too dry, but we're going from the sacrum, which is the bottom of the spine, one of those 5 fused vertebrae, and it's running at various points along the spine, essentially all the way up the spine to the top of the neck. So it's attaching directly to the vertebrae, and it spans 2 to 4 segments. So like a fiber of it, or a full muscle of the multifidus, will span 2 to 4 segments of the spine, but also it runs the entire spine. Does that make sense, Keoni? Am I
it does.
Expressing that adequately?
Yeah, it does. So there's kind of an overlap with the fibers, right? With every few segments, every segment,
every handful of segments, and then we know that it's spanning different fibers 2 to 4 segments at a time. And what does that speak to? It speaks to that local stabilization, right? Because we deal, and this is a adjustment when you go into PT school that you have to kind of learn, is that we deal in segments. I could never just affect, let's use a vertebrae, for example, T7, your thoracic 7th vertebrae. I could never mess with T7 and not affect the bottom and the top.
Right.
So I've always, and that speaks to the facets, how they interact with each other. That speaks to how the whole spine's a unit, all that kind of stuff. But that lets us know that we're talking about segments. The spine works in segments, and all these segments that we broke down are performing varieties of those movements that we broke down at any given time. So it spans 2 to 4 segments, going from the spinous process, which is like the little tips of your vertebrae. If you're looking at them from the side, that's the nose of the moose, right? And then it's running up and attaching to various points along the vertebrae. It performs as a muscle extension rotation, and stabilization. So that would be really important to remember. The stabilization part, we got its co-contraction with the TA and that sort of thing. We've talked about that, but it extends the spine and rotates the spine. So obviously we have two, one on each side of the spine. So if we're rotating to the right, for example, you're using that right multifidus more than you would be the left, right?
Right.
And that talks about some of the exercises, or points to or alludes to some of the exercises and why they work the TA so well, or the multifidus so well, which we're going to get to right after just kind of talking about the TA. So the transversus abdominis, the muscle that spans the front, it's the front of that room we just broke down. Huge muscle that basically looks like a weightlifting belt in the front. And this goes and attaches from the ribs and various points of the costal cartilage there in the ribs, and comes and attaches to the thoracolumbar fascia, which is a huge sheet of connective tissue in our lower back. This is important because the multifidus also happens to attach to that thoracolumbar fascia. And this attachment, this common attachment, is what gives us that co-contraction, that cinching down of the abdominal corset. So what does the TA do? Compress, AKA put on the tight pair of pants, suck the belly button in and up, and support the abdomen. So some exercises for this, I'm going to let everyone know that I have a variety of exercise demos on my YouTube. So if you hear a name, and I know I can only, break them down so much in audio form. So if you want to look these up, look them up on, just type into YouTube, Bryan Brozy, and then the exercise, and it should pop right up for you. So I'm just going to go through them really quick, Keoni, and we can maybe talk about a few of them and why those specifically. So I've got a TA contraction where I just start with everyone, which is essentially that cue of sucking your belly button in and up. And I want you to take that and keep that in the forefront of your mind when you do any ab exercise as well. That's how I want you to start. Start by sucking on that tight pair of pants, keeping that compression, keeping the belly button sucked in and up, while also maintaining a normal breathing pattern. So then we can do bridges, quadruped bracing, where we're moving an extremity, but stabilizing our spine. I've got a bird dog there that really speaks to the extension, the rotation, and the stabilization. That one, again, is on my YouTube. A multifidus reverse curl up. This would be where you're seated and you go into flexion. So we broke that down before. And then you segmentally curl up. So how I do that in the clinic, Keoni, is I'll give someone like a foam roller and put them in a chair and put the foam roller right along their spine. And I want them to work their way up the spine from the bottom, touching that foam roller. So
that foam roller is parallel to the spine.
Parallel to the spine, right up against the very base of it. And they're forwardly flexing and raising up extremely slowly with that tight belly button squeeze, vertebrae by vertebrae, and feeling each vertebrae one after another as we go up, touch that foam roller.
Yeah, it's cool. That's a great one.
And that one's very specific, right? So this is where we get into, hey, we've got to perform specific local exercises. And a lot of people, Keoni, are scared of like high levels of flexion in their spine. And there's good reason to be, for a variety of reasons, but this is an example of when we do want a lot of flexion, and we do want to, we make fun of people with their deadlifts where they're really rounded and puts a lot of pressure on their back. But if you're doing it well and safe, that's an exercise I've given people in the PT clinic to work their multifidus. Now, of course, we're talking about super low load, all those feedback cues that we were just talking about, segmentally up, that sort of thing. We're doing the exercise perfectly, but we're doing it with a lot of flexion to really get that multifidus as we come back into extension. And let me back up for a quick second.
A lot of detailed focus, right? I mean, that's the key.
Exactly. And it starts with, it really starts with awareness.
Right.
And that's where all this starts. And that's why I start with like the supine TA contraction, supine just being laying on your back. The TA contraction, squeezing your belly button up and in, is where it all begins. And then like we've talked about it in the lower cross, upper cross episodes, where can you do that and then maintain your breathing is the very next step. Then we start adding various stimuli. Like, for example, I talked about the quadruped bracing exercise where you're maybe moving an extremity like a bird dog. There, the whole point, I think a lot of people break down their exercises and focus on what they're moving. And this is a great example of an exercise where it's not focused on what you're moving. It's focused focused on how well are you stabilizing the movement.
Right.
So it's about you, basically your extremities moving and wanting your whole body to move and react to kind of control the balance aspect of it and all of that. And it's about you quieting that movement down once it hits your trunk.
Right.
So it's not about how much movement we're doing or what movement we're doing. It's about causing a lack of movement in the spine while we move other things or respond to external forces. But so the multifidus, we've seen, I want to back up real quickly because it's just important. The multifidus we've seen in variety of studies, Hodges, Hydes. These are 4 various studies just off the top that point to this specifically about the multifidus, but it doesn't spontaneously recover after low back pain, Keoni. So what we see is when people get back pain, the multifidus can atrophy, it can have fatty deposits, and then it can be less coordinated in its firing and possibly reduce firing capacity. And so what's important about that is that points to the reoccurring back pain episodes that we had talked about just a second ago. So if you're getting this reoccurring back pain without addressing this local stabilization, the fact that we see in scientific research that the multifidus doesn't spontaneously recover in its activity, it doesn't spontaneously just grow without training once we stop having back pain, that's why we get these reoccurring episodes.
So that's probably one of the reasons why most people have back pain, right? I mean, nobody's thinking about the multifidus when you are trying to, well, I guess nobody except PTs.
Preach about it, Keoni. I mean, you're exactly right. People, will tell me, I met with some people today and one worked as a nurse and she's like, well, I have back pain that comes and goes. Sometimes it's really bad and I feel like I threw my back out. But I don't have it any now. I haven't had it for a month or so, but I've been a nurse for 30 years and I've probably had 10 episodes or so. And it's like, well, I'm sure you did something maybe a little bit more sinister in that moment, but it all starts with this.
Yeah. Yeah.
And then one last exercise just to mention here for the TA and the multifidus. I've got a video of this one, the Pallof press. That's Pallof press. You can do it with rotation, without rotation. I break it down in the video. It's a perfect spinal stabilization exercise, and I love it.
Can you explain that? I don't know what that is.
Okay. Yeah. So all right, we'll keep going with the demo. So we're all sitting here or standing wherever we're at facing forward, right? If we clasp our hands together, almost like they're in a prayer position in front of us, we would have a band in our hands that's, let's say, pulling or attached to the wall on the right side. And we're keeping our belly button sucked in and out, and we're facing, if it's on the right side, we're facing a 90-degree angle, right? So I'm not facing where the band is. The band's wanting to pull me into right rotation, but I'm facing forward 90 degrees from where the band is. I suck my belly button in and up, keep that contraction throughout. I press the band out and pull the band in nice and slowly in front of me. So what's that doing? That's working the multifidus and spinal stabilization, obviously, because this is a perfect example of limiting the movement in the spine. It's not about the movement that we are doing. It's about quieting the noise around us or from our movements. And then that band pulling you to the right, or the cable machine, whatever weight you're using, pulling you to the right, is forcing that left multifidus in this example to maintain extension of the spine and fight that right rotation.
Yeah, that's great.
So you're getting direct firing of the multifidus and you're getting that perfect stabilization focus where, again, the focus is not the movement we're doing. The focus is quieting the movement within ourselves despite our extremities or the external force of the band.
Awesome. Okay.
That makes sense as far as the forces and what the difference is between like quieting the noise that's coming to our trunk versus focusing on the movements we are doing. Then I want to talk about the last 2 muscles here. These will be real brief, the internal and the external oblique. So all we need to know is these attach to a variety of points in the body. The internal oblique has that attachment to the thoracolumbar fascia. So what does that mean? It's a part of that corset. It attaches all to this connective tissue that can cinch down the spine and give us stabilization. And then it attaches to various points of the hip. The external oblique does not attach to the thoracolumbar fascia, but it attaches to the ribs and then various points in the hips as well. They both work together to compress, support the abdominal region, and flex and rotate the trunk. So here we're talking flexion and rotation. And the way the fibers run, they run obliquely, right, at an angle. and they run in different directions. Like the external oblique is the opposite of the internal oblique and vice versa. And the way they run means we want to do a variety of angles when we do flexion and rotation exercises, right? If I'm just always flexing and rotating the exact same way, I'm not getting the full use of these muscles or fully preparing for functional life, right? When I bend over and grab the groceries, I'm not always in a perfect position.
Right.
So we're preparing the muscles to work in every position that could occur throughout our daily life. Some quick exercises here. And again, I'll tell you the ones I do have them on YouTube. You can do a crunch with rotation, just breaking this one down a little bit more to really hone in on it and make it perfect for you. You lay on your back, knees bent, start again with that supine TA contraction, squeeze the belly button in and up to the spine. From there, maintain that pressure, flex forward to where you lift your shoulder blades off the ground, keep that lift and rotate to the left and rotate to the right, all within the trunk. Don't let the arms or the neck drive the movement, right? Lead with the breastbone because these are attaching to the ribs. So lead with that front of the rib cage.
So it's not exaggerated like a bicycle crunch would be.
Exactly.
Yeah.
Exactly. And then you're keeping that time under tension throughout that exercise by doing it deliberately and slowly, like I broke it down. Doing that TA contraction, keeping that, using your rectus abdominis, that's the six-pack muscle, to lift your shoulder blades off the floor and then rotate from there. Very slow, controlled, deliberate, like you mentioned, Keoni. Examples: standing ab twist, recliner knee tucks, crunches with rotation, like I just broke down. And an exercise I love that I have a YouTube clip of is called the leaning towers. I've seen a lot of people do various exercises in the gym where like maybe they have a plate or a dumbbell and they're just kind of like leaning to the side, right? And coming back up.
Right.
Terrible. Hate that. Hate that exercise. I love the leaning towers as a substitute for that one. And that one's got a band or a cable, and it's on my YouTube. So if you want to find that, leaning towers, like Leaning Tower of Pisa or Ibiza, Pisa or Ibiza?
Pisa.
Pisa.
Pisa. Pisa. P-I-S-A.
Keoni's going to take me on a trip one day.
Yeah, we'll definitely got to go to Italy.
and we'll eat the tomatoes. Episode 58, 56, whichever one that is.
Right. Definitely.
So the leaning towers, you type that into Google, Bryan Brozy, leaning towers. There's a full demo up there.
Cool.
All right. One big thing I want to talk about here is just spinal stabilization despite osteoporosis. So if you have osteoporosis or have osteopenia, you probably know that you don't want to, or you want to limit flexion and rotation of your spine, right? So, or if you didn't know, now you know. We want to limit flexion and rotation of our spine when we have osteoporosis or penia. So how do we, work this six-pack, work the core, develop this spinal stabilization without the ability to do that? We do it with the exercises that focus on minimizing spinal movement while moving or responding to other forces. So an example of this would be like a pal-off press without the rotation, or a banded walkout. So at the end of the pal-off press, holding that squeeze and walking laterally, like to the left away from the band on the right side. So you're responding to that various tension. I have a bunch of plank variations that do this, like plank marches, plank rotations that don't actually rotate the spine, but you rotate your entire body and you're using your shoulders to drive that rotation, but you're keeping the spine nice and neutral. And then stir the pot is an exercise where you're kind of in a plank on a stability ball. And with your arms on the stability ball, you essentially do a clockwise or a counterclockwise motion. All of these exercises would be done while maintaining the natural curvatures of the spine and maintaining that tight squeeze of the belly button in and up.
And these are on you have videos of these too, right?
Yep, I have videos of most of these, I believe.
Okay, cool.
Yep, stir the pot for sure. And I think some of the plank variations. But that's a great thing to just know as far as osteoporosis is limiting that flexion and rotation, and that makes it a great opportunity to do exercises where you're focusing on minimizing the movement of the spine despite the forces that are acting on the spine.
Right. So makes me think you have severe osteoporosis. Sit-ups are probably not a good idea.
Sit-ups are a bad idea.
Yeah. Okay. Same with crunches, I would think, right?
100%. Yep.
Okay.
Yep. And that's where it becomes a great challenge to, develop that core, but it's absolutely can be done and it's about your exercise selection, doing it safely.
Right. Because just so you know, you probably know this, Bryan, but I have a lot of patients who have osteoporosis,
Mm-hmm.
and they'll come into me and they'll say, well, my doctor told me don't flex my spine, and that's it.
Right.
That's all they
Yeah.
tell them. They're like, so I can't exercise, and that's what they basically go away with. That's what they're hearing.
Right.
And then they're like, well, that doesn't make sense, because if I don't exercise, my bones don't get stronger, my muscles don't get stronger. And so,
100%.
right.
A
so,
vicious
so
cycle that the conventional wisdom makes us fall into.
right. Right. So yeah, no, it's good. That's very important. It's good to know. It's something that I have to remind myself to tell my patients about constantly. And I'm glad we're talking about this, because now we have, now we can direct them towards this podcast to say, okay, well, here's some exercises you can do
Yeah,
to
absolutely.
help with that.
I know we did, I think it's episode 24, which was our bone health episode. Maybe we could redo that and update it, but that'd be a great one to go back
Yeah,
and
I think
listen
it
to.
does need to be updated. Yeah, definitely.
But those are some exercises, like Keoni mentioned, they are on YouTube, and it's important. And it's unfortunate that most people do walk away with kind of a misunderstanding from their doctor that you don't want to be actually exercising because you want to
Right.
be really safe and baby your spine. And that is just simply not the case. We want to
Right.
avoid certain motions. We want to work out intelligently, but we are not going to baby the situation because it's only going to get worse.
Right. Right.
And just really quickly, as far as how to work these muscles, they're dynamic postural muscles. So just to start out working them, you want to work endurance, repetitions, high repetitions, prolonged holds. So like starting with that TA contraction, just a small example of how I would start dosing this depending on the person, is do 10 reps for 10-second holds while maintaining that normal breathing pattern.
Yep.
So, and
Okay.
just walk through there. Adaptation times, how long should you start to see an improvement in back pain, right? Within 4 to 6 weeks, you could see change. Those first 4 weeks are neural adaptations. The first 4 to 6 weeks are like, hey, more muscle recruitment, better connection between the muscle and the brain. We're getting more fibers of the muscle to fire, that sort of thing. After 6 weeks is when we see actual physical cell change, like hypertrophy and that sort of stuff. So at 4 to
Yeah.
6 weeks, you could start to see change and improvement. At about 6 weeks, you could start to see hypertrophy in those things.
That's
The,
great.
the key points, Keoni, motion's lotion. No motion is inherently bad, but uncontrolled motion is inherently bad. And that's kind of what I broke
Sure.
down here, that spinal stabilization, thinking of just picking up our groceries, right? The multifidus and all the muscles there are going through all types of muscle actions like eccentric, concentric, isometric, all in just that one action of picking up the groceries. At one point,
Right.
they're going through all those muscle actions. They're working for a prolonged amount of time. They are undergoing a variety of stresses, and thus we need to train them as such. We need to train them for that level of stress and the variety of stress. And the key muscles that we talked about are the multifidus, the transverse abdominis, the external oblique, and the internal oblique. And other than that, keep those endurance level repetitions, prolonged holds to start, and that's really due to the makeup of the muscle. And if you want this PowerPoint and you can kind of see the exercises and the muscles and all the information written out and some of the images I talked about, feel free to email me. Email's in the show notes, bryanbrozy@gmail.com, and I'll get that to you. Anything else,
Hey,
Keoni?
just one thing, Bryan. So as I'm listening to this,
Yeah.
one exercise that comes to mind that kind of hits all of this, I think, correct me if I'm wrong, but would just be, and I think a lot of people would know what it is, would be just be a plank, right? A static plank.
Yeah. So a static plank, as long as you're doing it correctly, right? You're
Yeah.
squeezing your belly button in and up. That would be the biggest thing, because then you're getting that cinching of the thoracolumbar fascia. And in that position, the multifidus is at least working to stabilize the spine, right? Hold it up from collapsing fully in, like collapsing down towards the
Yep.
floor. And
Yep.
then the internal oblique and the TA are working to hold you up and support the abdomen and compress. So you're exactly right. A plank. Not sure why I
Cool.
didn't say that to begin with.
Yeah. Yeah. It's an easy one, and most people know. So that's good to know. Like if you don't have your PT at your side, I mean, that's something you can work on at least,
Yeah.
whether you have the severe osteoporosis or not, right? I mean, because
Yep.
you can always rest. Yeah.
Yeah,
All right.
absolutely.
Cool. Awesome.
Awesome, everybody. Well, thank you for joining us. Again, feel free to email me to get the link, and we will be in touch next week.
Yep. Take care, everybody. Thanks.